I get to leave the stage now for a little bit. Taking my job for the next half hour or so until lunch is the man who heads up America's international aid effort. Please welcome Dr. Rajiv Shah.
Good afternoon, and thank you. It's an honor to be here today and to have the opportunity to follow Sarah. I have an incredible task at hand because, as you can see, we have a wonderful, talented, and experienced panel that is a large panel, and we each have about 2 minutes to share with you both our commitment and our insight in the context of this important and critical issue. I will take a moment to ask each panelist to be incredibly brief so that we can stick to our time today, but to briefly introduce my colleagues. Andris Piebalgs is the Development Commissioner from the European Commission, a good friend, a committed leader, and you will hear from him shortly. Bӧllhoff plays that role as the Director General for BMZ in Germany, and as well has made real commitments to this topic and to others. Baxter, the Director General of USAID in Australia, one of the few aid agencies like DFID that continues to drive big increases in their overall commitments. His Excellency Bernard Ami, the French Ambassador to the UK, we welcome you here. His Excellency Choo the Korean Ambassador to the UK, thank you for being here. Ruth Levine of the Global Development and Population Program Director at the Hewlett Foundation, welcome Ruth. Tamara Kreenan, the Program Director for Population and Reproductive Health at the David and Lucille Packard Foundation, welcome. And we'll have a video from Hillary Clinton joining us very soon, as well as a recorded statement with respect to the Bloomberg philanthropies. I wanted to start just by taking a moment to describe our enthusiasm on behalf of the United States for this important session. I spent very recently a few days in Yemen and noted that Yemen has a birth rate, a TFR, a total fertility rate of 5.5, a huge youth bulge, and precisely at a time when they're trying to achieve a historic economic and democratic political transition, they're confronted with issues of development challenges, population growth, health and women's welfare that are driven by the tremendous reality they face with the combination of high child mortality and high total fertility rates. We know and we've seen in country after country around the world that as child mortality coupled with effective family planning take hold, countries literally change the demography of their society and give themselves the chance to grow at a more rapid rate. We've seen in Southeast Asia over several decades, now documented conclusively by the World Bank and others, that effective family planning, effective child survival efforts together result in increased GDP growth of 1% to 2% annually, and that persists for 12 to 15 years, helping to build the basis of wealth and prosperity for hundreds of millions of people. So it's in that spirit that we're very excited to be making commitments today, and you'll hear from a broad range. The United States is proud, in particular, because we made our commitments to family planning the moment President Obama and Secretary Clinton took office. Already the global leader at about $470 million a year of investment in this space, the Obama administration has increased that level of support to $640 million on an annual basis every year. And in fact, our fiscal year 13 commitment is $642 million. The reason that's so important is that will allow us to reach 83 million women with basic contraceptive access and family planning services, all principled on being voluntary, demand-driven, and responsive to local institutions and local realities. And at the end of the day, that will help save 15,000 women's lives and help save 230,000 infant lives in the process of making these investments. These are real results for which the United States is deeply and will continue to be deeply committed, and we welcome a broadening of the circle of partners that is happening today to drive this outcome. I've described why this is... Thank you. I've described why this is important based on my visit to Yemen, but I'd like you to hear from Secretary Clinton about why this is important to our country and to our foreign policy.
I'm very honored to address all of you during this important summit that will help improve access to voluntary family planning for millions of women around the world. I especially want to thank the government of the United Kingdom and the Bill and Melinda Gates Foundation for hosting today's event. Reproductive rights are basic human rights, and women everywhere should have the right to decide when and whether to have children. But too often, in too many places around the world, these rights are denied. Millions of women and young people across the globe don't have access to modern forms of contraception. Today, you are demonstrating the solidarity of the international community behind a woman's right to make decisions about the timing, number, and spacing of her children, which is critical to the advancement of women, their families, and their communities. Your commitments will enable more countries to have effective and sustainable family planning programs and help ensure that women have access to the health care they need and deserve. Thank you for your hard work, and please know you have my very best wishes for a successful summit. Thank you all.
As we turn now to the panel, I'd just highlight three basic principles that we've learned in our 45 years of investment and leadership in this space. The first is the critical importance of country ownership. And you've heard from so many partners, USAID has actually transferred and graduated 21 of our programs to local institutions and procurement systems that have been built up through partnership and engagement. The second is innovation. We're proud to partner with DFID and the Bill and Melinda Gates Foundation on efforts like the Depot in Uniject mechanism that would provide an easy and simple tool that will empower even more women to be successful with gaining contraceptive access. And the third is integration. We know, even as we celebrate family planning today, that all of us work within the context of real health systems. And we see patients, not specific interventions, people, not specific ideas. And it's important that we're all responsive to that basic reality if we're to continue to have the success stories that were outlined earlier today by Minister Tedros and so many others. So with that, let me turn to you, Andris, for your comment. If you could describe the EC, of course, plays a critical role in both marshaling the efforts of member states and setting its own agenda. How will you be accelerating your work in family planning and global health?
Well, EU is definitely unity of 27, soon 28 member countries, with Croatia joining next week. And development cooperation basically is provided in the name of Europe, which each nation is proud. Also here in the panel, some European nations that have bilateral programs, but they also have programs as a Europeans. Second, as EU, we have ability to work much more across the world. So we are represented more than 100 countries, and in 32 countries we have very deep cooperation on health issues. And third, is Raj, what you mentioned, we very much support the country ownership strategies for health and family planning. So yearly we disburse 500 million euro for the health support system. 100 million euro we can track is being spent on family planning issues. So in the additional top-ups that we agreed to support the children's health and maternal health with 280 million euro, big part of it again will be for family planning. So I think the strength of the EU is really to have support for countries' own health systems, primary health support systems, where family planning plays a big role. And I think this is the main channel to keep sustainability of effort. Saying said this, we also see that there is need on top of it. And I can announce today that 23 million euro fresh pledge for support the global pipeline of commodities, that is crucial, and support to civil sector, because a lot of issues are related also to perceptions and also cultural difficulties that sometimes you meet in it. And the best way to address this is actually using civil society. But last part I would like to emphasize what I believe in this great summit, and I applaud Andrew Mitchell's and Melinda Gates' leadership, is also to speak about more political rights, because at the end of the day, you can be successful with family planning in the places where is democracy, where is human rights, and where women's role in society is improving or is being exactly equal to the other part of the society. And I came from Tokyo, where we discussed support for Afghanistan. And the main issue actually around the table was women's role in society. We did not talk about the family planning, but women's role in society has been seen by everybody, including now also the government, as a success of prosperous and self-sufficient Afghanistan. So that means that it's not only about pledge for family planning, but it's crucial that we continue to support also in countries in the way of strengthening democracy and human rights.
Thank you. That is an excellent commitment. And I think we particularly appreciate the points that this lives within a significant EU commitment to health systems, to women, to cultural norms, and we hear you. Thank you. Director General Bølhoff, last year Germany launched an initiative on rights-based family planning and maternal health. Could you tell us about that and how that ties to your commitment here today?
Yes, thank you very much. Germany launched the Rights-Based Family Planning and Maternal Health Initiative in May last year. And it's our contribution very much to reach G8 Muskoka initiative and the global strategy, Every Woman, Every Child. The goals of this initiative are very much, the knowledge and acceptance of modern methods of family planning, access to modern methods of family planning, and an increased number of births attended by professional staff. And our strong conviction is that it's not only about finances and money. It's very much, getting the political commitment in the countries, in the partner countries, the inclusion of many stakeholders, as you pointed out, the civil society very much engaged, and to focus also on the demand side. So I think it's really great to get everybody together here, and also from our side, thank you very much to DFID and the Melinda Gates Foundation to take that initiative. So on the initiative itself, let me point out 5 pillars. So one is very important, the political prioritization to work out with our partner countries. Second, of course, is the financing. And Germany is doubling the bilateral commitments compared to the years from 2008 to 2010, including our support to UNFPA and IPPF to 100 million euros every year from 2012 to 2015. A third pillar is, of course, the inclusion of the new stakeholders. Then we have focusing very much on education, and this fifth is the training of the professional staff. So our attempt at the moment is very much that we particularly work on family planning in those countries where we have a focal point on health, which is, and I'm glad that you mentioned it, Yemen, Malawi, Pakistan, Rwanda, but we are very open to any other countries.
Good. Thank you. We appreciate the commitment, but also you're framing this in the context of your larger work in health and your focus on women. Director General Baxter, we know most of the discussions today, many of the examples, many of the photos relate to Africa and other parts of the world. USAID has a significant presence, obviously, in Asia and the Pacific. Could you tell us about what you're doing in this space, and are there any unique attributes of your leadership in the context of Asia and the Pacific?
Thanks, Raj. The Asia-Pacific is really characterised by its diversity. On the one hand, you have Indonesia, the 4th largest country in the world by population, but also the 4th largest country in terms of unmet family planning needs. And at the other end of the spectrum, you have countries like Tuvalu with 10,000 people. So the diversity is really the characteristic there. You have a country like Cambodia, where it has the lowest use of contraceptives of any country in Southeast Asia. and a country that is very close to my own, Papua New Guinea, where there's really quite a staggering and quite disturbing statistic that 80% of women don't have access to family planning at all. And then one of the world's newest nations, Timor-Leste. In Timor-Leste, the average woman has about 6 children, one of the fastest growing populations in the world, and a population that will triple by 2050 based on current rates. So the challenges are there. And that's why Australia is announcing today that we're going to double our efforts in funding family planning activities. And we will do so by training more health workers, by providing more commodities, by providing more infrastructure so that women can get access to family planning when they need it. But we'll also be doing more in the field of education to give women the knowledge that they need to make the choices and to exercise their rights. Our commitment to double family planning spending comes on top of a commitment we made recently to spend $1.6 billion on maternal and child health. So we're very proud to be part of this event today. And I'd also like to inform people here that tomorrow morning in Australia, it's nighttime now in Australia, but tomorrow morning in Melbourne and in Sydney, the Australian government, alongside our civil society partners, will be getting together to have breakfast and to look at what's come out of this conference today. And again, we're very proud to be part of it.
Well, thank you, Peter. Are you going to actually be there tomorrow morning for breakfast? Because if you can pull that off, we'd be very impressed.
I can just make it if I leave now.
Thank you for your leadership. Director General Hiramatsu, we know that Japan has already been a very significant health partner for 15 years, probably longer, and is planning on using the Tokyo Conference on African Development, the TCAD meeting, that's upcoming to help highlight some of these key issues. Could you describe your commitment?
Thank you, Dr. Shah. As you mentioned rightly, Japanese government has been attaching great importance to issue of family planning for many years. We have learned a lot from our experience by especially combining maternal health and family planning with community-based approaches. That is very much important for sharing the information experiences with other countries, especially developing countries. Our motto, slogan is always, purpose of family planning is the happiness of individual life. It is very important to make sure that each individual life can be assured by this family planning. For that purpose, in order to share the experience with other countries in need, Japan has been providing assistance to a number of countries over the last half century and will continue to do so. Japan has announced 2 years ago, with the field of health issues, we committed ourselves $5 billion in 5 years. Out of that, since 2000, Japan has provided more than $570 million for assistance in family planning. This year, we are planning to disperse a total around $36 million to UNFPA and IPPF. As you mentioned, with regard to TICAD 5, in June next year, Japan will host TICAD 5, the 5 Tokyo International Conference on African Development. Africa has enjoyed 5.8% economic growth annually for the last decade, but is lagging behind in achieving MDG 4 and 5. We cannot leave women to suffer such an unbearable burden. Thus, Japan intended to focus on family planning as one of the key agenda items in TICAD 5. I also wanted to mention the importance of MDGs. And also, Japan has been leading a discussion on post-MDGs in cooperation with the countries like the United Kingdom. The core values underlying MDGs include poverty reduction and human security. In this context, I believe that family planning should definitely be considered as one of the key pillars of post-2000 agenda, 15 agenda. We are working very hard to make sure that at least, first of all, MDG 4 and 5 will be achieved by then 2015. Thank you very much.
Well, thank you for your leadership, and thank you for framing it in the context of a larger set of development goals that we all fundamentally believe in. Ambassador Bernard Ami, France has made significant commitments already to family planning and the Ouagadougou Partnership, working in 9 countries in Francophone Africa. Why is this something you've chosen to prioritize, and what are you learning, and how will you be taking this forward?
Well, I'm going to say a few words, but in French, because we do have a lot of French-speaking people in this room. We are paying interpreters, so we have to use them. Monsieur l'administrateur,
Mr.
le commissaire européen,
Commissioner,
c'est un grand honneur pour moi de vous présenter les engagements de la France à l'occasion de ce sommet sur la planification familiale au lendemain de la première visite officielle à Londres du président de la République François Hollande, qui a pu, avec David Cameron, évoquer l'aide au développement, marquer l'importance de cette conférence et dire que nous devions poursuivre nos efforts en matière d'aide au développement. Nos engagements sont d'abord de consacrer 100 millions d'euros à la planification familiale en Afrique de l'Ouest, ce qui revient à doubler les interventions de la France dans ce domaine. Dans le cas du partenariat de Ouagadougou, lancé en 2011 avec vous-même, cher Rajiv, l'USAID, avec la fondation Bill et Melinda Gates, la fondation Flora et William Hewlett et 9 pays d'Afrique francophone, la France contribue à l'amélioration de la contraception dans une région où les besoins en la matière sont immenses. Nos engagements s'inscrivent ensuite dans le cadre d'une coopération avec les organisations, agences et fonds des Nations Unies. Et nous plaidons en faveur du renforcement du Fonds des Nations Unies pour la population. Le mandat de ce fonds en matière de planification familiale est clair. L'impact de ces interventions dans ce domaine est mondialement reconnu. Nos engagements se déclinent enfin par une intégration de la planification familiale dans une perspective plus globale. Cette approche couvre la santé de la reproduction dans le cas des objectifs du millénaire pour le développement que nous devons garder à l'esprit en matière de santé maternelle et infantile. Elle couvre aussi les droits sexuels et reproductifs dans le prolongement de la conférence internationale sur la population et le développement du Caire en 1994. Et nos programmes intègrent ainsi la planification familiale dans les politiques d'éducation, de santé et de genre, en priorité pour les jeunes et les adolescents. Je voudrais conclure en disant que tout recul en matière de droits sexuels et reproductifs serait à nos yeux particulièrement préoccupant. Nous sommes déterminés à défendre la préservation de ces droits, en particulier dans la perspective de la préparation du 20e anniversaire de la conférence du Caire, anniversaire auquel nous accordons une très haute importance. Il s'agit à nos yeux d'une condition fondamentale du développement durable.
These are sustainable rights, they are fair rights, and they're inclusive rights. Thank you very much.
Thank you, Ambassador. We particularly appreciate your highlighting President Hollande's very early commitment during the course of his tenure to raising the visibility and investment in development overall. And this is a proud example of that going forward. Thank you. Ambassador Choo, we are honored to have you here. USAID in particular has had a proud legacy and history with South Korea. As one of the first countries to achieve near total universal access and contraceptive prevalence, and as the country that is often cited as the model for how these efforts have led to a demographic dividend that has accelerated growth. How do you think about your leadership role in this space?
Thank you. In our case, up until the early 60s, our fertility rate was more than 6%, but we implemented 4 5-year plans up until the early 80s. As a result, in 1984, our fertility rate was down to 1.74, and now Korea is suffering from a very low rate of average birth rate among the OECD countries. So some experts criticize that we overdid it. But anyhow, we'd like to share our experience and our information, related information with developing countries. Let me take the case with Lao People's Democratic Republic. Their government has committed approximately $6 million towards a 3-year period, concluding this year, to provide integrated maternal, neonatal, and child health services. Since 2009, my government, together with Korea Foundation for International Healthcare Service, have provided intensive technical support along with other partners to achieve the goals of the project, means improving sanitary, health, and medical infrastructure, enhancing the capacity of hospitals and other medical facilities, sharing sound planning, management, and service delivery techniques, as well as improving all maternal and child-related health care. In Cambodia, my government aids in the provision of fast-track initiative, we call it FTI, for reducing maternal and newborn mortality. More directly, my government established the Skilled Birth Attendance Training Center in the city of Battambang with $1.75 million US dollars invested from last year till next year to provide support and training for skilled birth attendants within the dedicated center, as well as other local hospitals and health centers. A further about $4 million US dollars from the Korean government is being disbursed between this year and 2014 as part of the Cambodian's maternal, neonatal, and child services project, which includes family planning. Looking ahead, my government plans to expand our overall ODA commitment from a modest 0.12% of GNI in 2010 to 0.25% by 2015. Thank you. Within this overall package, maternal and child health care, including family planning, is a key policy priority, I assure you. In 2010, Korea disbursed $5.4 million US dollars to maternal and child health care projects around the world. Again, this is a humble and modest figure. But we know we can do more, which is why the Korean government is seeking to more than double this figure from 2013 onwards. So over 11 million US dollars devoted to maternal and child health projects. Thank you.
Thank you. We appreciate those commitments, and it's not humble given the power of your example and the strength of your commitment with your partners and the value that you bring in that context. So thank you very much. Ruth Levine, a friend and colleague, someone who obviously has prioritized this area of work in a number of roles now with the Hewlett Foundation. Share with us what you think of all of this and what you can do now in the philanthropic sector to help move this agenda forward.
Well, like USAID and several other private foundations, the Hewlett Foundation has a very long-standing and steady commitment to family planning around the world. In fact, one of the first checks that Bill and Flora Hewlett wrote when they started their philanthropic giving 50 years ago was to Planned Parenthood. And that commitment has remained, and I'm very pleased and proud to be able to reaffirm it. The kind of support that we as a foundation provide really reflects our belief that family planning and more broadly reproductive health care is a right, and it is a route to better health, better family well-being, and economic growth, and better stewardship of natural resources. The support we provide really to many organizations represented here helps to extend access to family planning services as well, where legal and appropriate, to abortion, safe abortion, and post-abortion care. We also provide support to organizations that help to channel the voices of citizens to place demands on their governments and on donors to do more and to do better in this area. Within the context of the work that will follow this summit, we're placing special attention on civil society actions that can help to hold governments and donors accountable for these terrific pledges that we've heard today. And we're inviting all of you to also hold us accountable for maintaining our financial support in this area. Right now, it's about $20 to $22 million a year overall for our international population work. Of that, about $13 million for the advocacy and service delivery work. We anticipate maintaining very much at that level, doing more as we can, but certainly maintaining at that level. And working with everybody on this stage and all of you, not so much to bring family planning back, but really to bring family planning forward.
Thank you, Ruth. And I think given the commitments you're hearing today, you'll have the opportunity to explain to others at the foundation how your work is certainly leveraging the efforts of others given the success of this meeting. Director Knapen, thank you for joining us. We'd love to hear about the Packard Foundation's work in terms of specific areas and geographies of interest in family planning as well.
Great, thank you. And thank you for your leadership. So down the road from Hewlett, Packard is proud to make a commitment of $24 million that will advance the various issues surrounding the Family Planning Summit. And I would say there are three areas where we're really honing in. One is demand, another quality, and finally advocacy. So we think critical to ensuring that we reach the goals of the Family Planning Summit are creating demand and making sure that the women and girls around the globe are situated so that they can make very positive reproductive health choices, that they're well educated and they have access to services. Secondly, we think a lot about quality of services. I know oftentimes when I travel, I watch women line up around a clinic, and then they get to the door of that clinic, and there are no choices of methods, and there are no methods that they want. And we want the opposite for the women we work with. We want to assure that they are welcomed into a clinic and that they have a wide range of services. And so our work includes training providers and perhaps looking for innovation in various methods. And then finally, we think it's critical that we empower civil society to be advocates and to assure that there's an ongoing political will around family planning and reproductive health. And my final commitment to you and to everybody in this room is that we'll stay the course, that we won't see this as a one-off. We've been engaged here for many, many years, and we will continue that engagement and look forward to working with all of you.
Well, thank you. We appreciate your last point about staying the course. As we've seen from so many, the successes here accumulate over years and decades. We're now going to have the chance to hear from a new participant from the philanthropic community in this work, whom we're excited to hear a video address from Michael Bloomberg at this point. We hope that this will both inspire us and that he will stay the course as we go forward.
Greetings from New York City. In a summer full of extremely exciting events in London, from the Diamond Jubilee to the Olympics, none could be any more important than the Summit on Family Planning. Each year, there are 75 million unintended pregnancies in developing countries. Making affordable contraceptives, information, and services available to an additional 120 million women and girls by 2020 will save 200,000 lives in the poorest countries that would have been lost in pregnancy and childbirth. And I'm extremely pleased to announce that Bloomberg Philanthropies will become a partner in this groundbreaking global initiative with a contribution of $50 million. Providing open access to affordable family planning information and services has been a special interest to me for a long time. It's been a priority of the New York City Health Department since I've been mayor, and I've personally supported organizations that offer such services and who, regrettably, must continually fight for the right to do so. Bloomberg Philanthropies is currently working to improve maternal and child health in some of the world's poorest regions. In Tanzania, for example, we've improved access to emergency obstetric care and raised the standard of care for mothers and their children in some of the most isolated parts of the country. I think this work underscores for us how truly important integrating family planning services with obstetric care is. One reason we are proud to join all the many organizations, individuals, and governments who have come together to support the goals of the summit. No one has worked harder to set this amazing initiative in motion than the remarkable Melinda Gates, the UK government, and all of you. To everyone, I simply want to say, what you are doing will make an enormous difference. It will truly save lives. It's an honor to be part of it. Thank you.
Wonderful. Well, we've had a chance to hear from so many important leaders about these great new commitments, and I'd like to conclude just by highlighting 5 things that I've heard through this discussion very quickly. One is stay the course. We have commitments here, but we know success is about focus and execution over time. The second is integration. So many of the comments were about how this is an integrated investment to build health systems, to understand and work within cultural norms in countries, and to support basic human empowerment for women and for girls, and that's how we see this investment. Third, to create an environment that brings in exciting new partners like some of the foundations we've heard from, but also builds the capacity of the great institutions that have core responsibilities here, like UNFPA, IPPF, and others that were mentioned a number of times. Fourth is results. At the end of the day, we know these investments generate real results, and for us in the United States, I suspect in the UK and in so many other parts of the world, it's those results that break through the potential controversies and build the broad political coalitions that can allow us to achieve success. And fifth, and I'm particularly grateful to Andrew Mitchell, Prime Minister Cameron, Melinda Gates, and others for highlighting this, is it points out that this is just a core example how today more than ever, investments in global development, investments in global health are more critical to our national security, are more critical to our global prosperity, and are more capable of achieving improvements in basic human aspirations and basic human dignity for women, for children, for families in every corner of the globe. And so we are honored to all be here together. We hope we got through this on time on behalf of Andrew and the organizers, and we're thrilled that going forward in a spirit of partnership, we can deliver these kinds of results as part of a renewed commitment to development and health overall. Thank you, and thank you to each of our panelists.